So thank you, everyone. You know, putting on these webinars takes a lot of hands and a lot of work. And so I appreciate your patience, but we are here to talk about what is therapy. Next slide. So what to expect from a therapist. So we have a really creative new way for you to share your information about what is therapy and what you expect from a therapist. And so next slide. We'd love for you to get out your phones and help us to understand what you would expect from a therapist, right? And so we're going to use a new way to gather your information. So if you want to log on to pollev.com/WorkWell NYC 12 WorkWell 12125. Okay, I'm gonna put that information in the slide deck because, like I said, it takes many hands to get this together. And so this is a new opportunity for us, a new thing that we hope to be very interactive with you. So what we'd like you to do is, okay. So 1 second. Samati, if you can just go back to the slide deck, that'll be fine. Okay, perfect. So want to get the information to you. So there's 3 ways for you to share your thoughts about what you expect from a therapist. You can type into you can type in pollev.com/WorkWell NY125, or you can text on your phone to WorkWell 125 to 2233, right? So if you're going to text, you just put in WorkWell 125, the number will be the 2233. Or you can take your phone, scan the QR code, and you will be able to pull up the activity. Can I get a thumbs up that most folks understand it? Awesome. Oh, you guys are doing it. Okay, so now, Samati, please allow me to share the screen. So this is what you all are sharing with us. These are the things that you are saying you expect from a therapist. Someone to listen, solutions, a soundboard, someone to give you some discernment to navigate, help, guidance.
Engagement. I like that one.
Uh-huh.
We're getting a lot of answers.
Oh, this is awesome. I hope you guys like this. I love this activity. Solutions.
A safe space.
A safe space. Yeah. Guiding. Information, demeanor is important to you. Resources. Tools. And so the larger letters are the most common things people are saying. Awesome. Compassion, emotionality. This is fabulous. Ask questions. I see some people said in the chat.
Resources.
Discretion.
That's an important one. Confidentiality.
Awesome. Awesome. Well, keep going. We'll take a picture of this and share it with all of you with a follow-up email, just so that you can see what other people are thinking. And it sounds like, and it looks like you all are also thinking about the same things about what your needs are when you think about engaging in therapy. Awesome. I see non-judgmental. Wonderful. So Samati, you can start sharing again if you like. we'll just move on. Okay, next slide, please. That was really fabulous. Okay, so let's dig in. So we learned about what folks are hoping to gain from their work, or what they would expect in therapy. So let's dig in about what is psychotherapy. Next slide. So as you can see here on your screen, the definition is psychotherapy is a type of treatment that can help individuals experiencing a wide array of mental health conditions and emotional challenges. Psychotherapy can help not only alleviate symptoms, but also certain types of psychotherapies can help identify the psychological root causes of one condition so a person can function better and have enhanced emotional well-being and healing. And so psychotherapy is a really great opportunity to have an objective person learn their thoughts, help you to create some goals and be able to achieve them. Next slide. So who's the right person for you? So as you can see on the screen here, there are three different clinicians, or actually four, but three different areas where you can receive help. And so psychiatrists are trained medical doctors able to prescribe medication. That's the most important thing to remember about psychiatrists, right? You do have very few psychiatrists that will provide you with ongoing services as far as talk therapy. For the most part, a psychiatrist is there to assess your needs and prescribe medication. You'll see them perhaps on a monthly basis, and they will check in with you really briefly. The first session will more than likely be a longer session just to really get a great background and understand what your needs are, but the check-in sessions are usually pretty brief. Psychologists, they hold doctoral degrees in psychology and are generally oriented to the ways that thoughts and feelings interact with social factors. And psychologists are normally very specific in the services that they provide. And a mental health professional has a master's degree and are qualified to evaluate and treat problems, providing counseling and psychotherapy. And so when you think about mental health professionals, you normally will hear a clinical social worker like Arabia, or myself, which is a mental health counselor. We're the most common titles that you'll find as a therapist. And these are the types of clinicians that would provide the different services for you regarding psychotherapy. Next slide. So common types of psychotherapy. Cognitive behavioral therapy helps people identify and change thinking and behavior patterns that are unhealthy or ineffective, replacing them with more accurate thoughts. And cognitive behavioral therapy is a very common way, a modality of psychotherapy. Interpersonal therapy, as you can see, is short-term form of therapy of treatment, and it helps patients understand underlying interpersonal issues that are troublesome, like unresolved grief. The choice of therapy type depends on the patient's particular illness and circumstances, and that's important to think about, and his or her preference. And many psychotherapists, as well as psychiatrists, they use a variety of different types of therapy. It all really depends on the presenting issues, presenting concerns that a client brings to a session. And it's really important to understand what things may be important to you. And so we'll go through some of that a little bit later, but these are the common types of psychotherapy. Next question. So benefits. There are many benefits to therapy. But research shows that most people who receive psychotherapy experience symptoms of relief and are better able to function in their lives. About 75% of people who enter into psychotherapy show some benefit from it. And psychotherapy has been shown to improve emotional and psychological well-being and is linked with positive changes in brain and body. The benefits also include fewer sick days often if someone perhaps has deep depression and has a hard difficulty in getting out of the bed, psychotherapy can help to reduce those symptoms and engaging the person in a way that they can actually get up, get out, and perhaps re-engage in their daily activities. Less disability, fewer medical problems, and increased work satisfaction can be benefits of therapy. Next slide. So when to ask for help, I will pass this over to Arabia to walk us through when to ask for help.
Next slide. So when to ask for help. Ways to figure out when to ask for help in regards to receiving counseling is to first ask yourself, is there a current issue in my life causing distress? So when I say distress, some questions that you might think of is, do you spend some amount of time every day thinking about your problem? Is the problem embarrassing me in some way? Do I try to hide this? Or is the problem redirecting my quality of life? Is it rearranging the things that I'd like to do in my life? Also, question number 2, is this issue interfering with some aspect of my life? Has the problem made you change your lifestyle? Is it kind of preventing you from engaging in the quote unquote normal things that you usually do in your life? Next slide, please. Another way to kind of check in with yourself in regards to when to ask for help is ask yourself, simply put, how am I feeling? What's going on with my body? What are the emotions that I've been experiencing on a weekly or day-to-day basis? Next slide, please. So for instance, after you kind of check in with yourself and ask yourself, how am I feeling? What am I experiencing? Some things that might come up for you are excessive worry or fear, eating or sleeping too little or too much, feeling unusually confused, on edge, or scared, prolonged or strong feelings of irritability or anger, avoiding friends and social activities, overuse of substances like alcohol or drugs, or possibly the inability to carry out daily tasks. So I just want to note that this is kind of like a very condensed form of some of the things that you might be experiencing from the National Alliance on Mental Health. And I know sometimes deciphering the differences between what you're experiencing and symptoms of mental health can be a bit confusing. Yet there are some symptoms that can attribute to like mental illness. And like I said, this is a very condensed form of that. So if you would like a longer list, you can always check out the National Alliance of Mental Health, or you can talk to a therapist or call EAP and we can talk a little bit more about that. Next slide, please. I would also like to note, right, mental health is a positive concept. It encompasses our emotions, our psyche, and our social interactions. Meeting the hierarchy of needs for ourselves is very important to showing up in all aspects of our life. I would like you to think about seeking help as a form of self-care. You are outreaching a therapist or scheduling services for 45 minutes to an hour of dedicated time just for you. This is a safe space to only focus on what's going on with you and to possibly improve your well-being. Next slide, please. Now we'll discuss where to begin. Next slide. Back to you, Ryan.
Awesome. So where to begin? Find a therapist, and certain things you should consider. So Arabia talked about what's causing you distress, right? What is coming up for you that's making you feel like you need to talk to someone? So that's the first thing, right? Understanding what that is for yourself. Thinking about, will you use insurance, or are you going to pay out of pocket or self-pay? What type of provider are you looking for? Are you looking for a psychiatrist? Do you need someone to prescribe you medication? Is that something that you're interested in? Do you want a psychologist? Do you want a therapist who is a master's level clinician? What are some of your preferences culturally? Do you have some cultural preferences that you want your clinician to be able to understand? Is their gender, their sexuality, their race, ethnicity? Is there a particular language that you prefer to speak? And so thinking about all of your preferences, thinking about what type of provider, how you're going to pay, And then again, when you're available to engage in sessions. So it's morning, afternoon, is it evening, weekdays, is it weekends? All these things are helpful things to consider even before you start your search. There are many clinicians available. And so also we're going to get into whether or not telehealth or in-person are your preferences. But they are many clinicians that can accommodate work schedules. But understand that this is just like any other doctor's appointment that you would have. And so clinicians are available to accommodate whatever your needs might be. Next slide. So how long do you want to participate in therapy? So this is another question for you to consider. Really, what is your goal? What do you want to achieve in therapy is going to be important for you to answer for yourself. The length of treatment will vary from one to another, right? And so what works for one person may not work for another. Perhaps someone may have a chronic condition or concern that's been concerning for them for a very long time. Someone else may not have a chronic condition. So it all depends on yourself, what your needs are. Recent research indicates that on average, 15 to 20 sessions are required for 50% of patients to recover as indicated by self-reported symptom measures. So things to consider when thinking about the length of time. So therapy successfully ends when the patient has accomplished the goals mutually agreed upon with the clinician, right? And so understanding that your relationship with the clinician is just that, a relationship. And so you should feel comfortable going into this, having those conversations with your therapist to say, I am or I'm not reaching my goals, and perhaps what we can do to support, and thinking about how long you would take to be able to reach your goals. Having that open communication is going to be really, really important. Discussing the length of time should be a part of your conversation. Absolutely. And if you feel as though it may only take 2 months, I think that would be helpful to you to initially to share with the clinician so you can get their opinion on what the time limit might look like. And treatment is often tentative and revisited throughout the course of treatment. I think that like I said, it's a conversation, it's a relationship. And so making sure that you share what your needs are throughout the entire time you're working with someone. Clinical research evidence suggests that people with co-occurring conditions or certain personality difficulties may require longer treatment. So when I mentioned earlier chronic, when there's a chronic concern, it may require a lot more time to delve into the work that you're going to be doing with your clinician. So something to think about, but I think the most important thing is to have an open conversation. Next slide. I'll hand this back over.
So now we'll talk about how will you receive services. So now that we've kind of talked about like the different type of providers, what type of therapy might you be interested in? So there is telehealth. For those of you who may not know, what is telehealth? Telehealth, sometimes called telemedicine, lets you see your healthcare provider without going to their actual office. You can have a telehealth visit online using your computer, tablet, or smartphone. Next slide, please. Then there's also traditional therapy, which is also known as in-person therapy. In-person therapy occurs face-to-face with a licensed therapist, usually within a private office setting or treatment center, such as a mental health clinic. Next slide, please. So let's talk about the differences between telehealth and in-person sessions. So some of the benefits of telehealth is it's convenient because you can basically connect with a therapist via video, phone, text, anywhere. There's definitely more flexible scheduling when it comes to telehealth. Virtual therapists tend to offer flexibility regarding scheduling and appointments because of its accessibility. Also, for some, telehealth can be less anxiety-inducing when engaging in therapy from the comfort of your own home. The benefits of in-person therapy is it's a neutral, designated private space for therapy sessions. It usually occurs in a space that is intimate and will alleviate any privacy concerns you may have. So if you are experiencing severe mental health crisis, an in-person therapist can better assist you. And something else I would like to point out for in-person therapy, as I stated, if you have any privacy concerns, such as possibly like interpersonal violence or maybe domestic violence, right? Or as New Yorkers, right, we all kind of like live in apartments and you might have like thin walls and you're concerned about somebody overhearing your conversation, I would definitely highly suggest in-person therapy if you're concerned about people overhearing you. Next slide, please. But even though telehealth is extremely like accessible and kind of like easier when it comes to scheduling, there may be some instances where telehealth may not be appropriate for you. So reason that telehealth may not be appropriate is if you're experiencing current suicidal ideation and you have low confidence in maintaining your safety, or if you're someone who feels unsafe or you're experiencing threats to your safety, people who have difficulties with concentration and attention. This may apply for very young children or people with diagnosed neurodevelopment conditions such as ADHD. Sometimes the screens aren't the best options for you. And in person, you can walk around, you can do various things within an office space, what might make it easier for you to engage with your therapist. Also, people requiring a translating and interpretation service because of confidentiality, right? You can't have another person on screen interpreting for you because we can't always, what's the word I'm looking for? Like we can't guarantee what's going on with the other person's computer at the time. So if you need translating stuff, you should definitely do that in person. Also, people requiring significant in-between sessions, support and care. If you need to see your therapist like more often because of safety reasons or kind of like you're presenting problems at the time, then in person would be best for you as well. Next slide, please. Ayana, back to you.
Alrighty, so where do you begin your search? So after you've answered all those questions, you've done that internal work to figure out what your goals are and what your needs are. The very first place to go, I suggest, is your primary care physician. And I say your primary care physician is a great start, especially if you've been seeing the same primary care physician for a length of time. One, they know who you are. They know, they have a wealth of medical information from you. And so they can be a great, great resource. They also can administer different screenings, so a depression screening, anxiety screening, to really help you to understand where you stand if those are some of the concerns that you're presenting. So a primary care physician is a really great start. If you don't have a long-term relationship with a physician, then the Employee Assistance Program is another wonderful resource. Understand, I honestly believe that Employee Assistance Program is an underserved resource. They're all licensed clinicians, and they are there to support you. They've worked with city employees for a very long time, for many, many years, and they have lots of experience and understand the different resources that are available to you, and will help you find that clinician that is a good fit. And if
Can I interject about the employee assistance program? We're getting a lot of questions in the Q&A regarding employee assistance. So yes, I just want to let everyone know, dependents are children and spouses. So they definitely receive our services for free as well. And every agency has access to EAP services. So no, there isn't an individual EAP at every agency. It's just that every agency has free access to us. So it doesn't matter if you work for ACS, DCAS, comptroller's office, whatever it is. It's just one number to contact us and one email address, and you all have access to that for free.
You should have just taken over that EAP part, but thank you, Arabia. So Psychology Today can be a great resource. So if your primary care physician has referred you someone and it didn't really work out for you, an employee assistance program, if that wasn't necessarily the route that you chose, Psychology Today is a good resource as well. And you can just go on Psychology Today, do look at the filters and filter out what your needs are, what some of the special things that you want a clinician to adhere to. And so Psychology Day can be also great resource. And so this slide, all the slides will be provided for everyone and as a resource, and the links are live in the PDF that you'll receive for the Employee Assistance and Program and Psychology Today, if you so need. Next slide. All righty, so what to expect from therapy? I'm going to hand this back over to Arabia.
Next slide, please. So now that we have kind of figured out how to access therapy, how to find a therapist, let's talk about what happens before your session, right? So you found your therapist and you are preparing for your session with that therapist. So before your first appointment, what you should do is prepare. Think about it as like an interview, right? You're going to interview this person who's possibly going to be providing you a service. So what you can actually do is write down a list of questions you may have for your therapist. Also, if you're doing telehealth, I would highly suggest identifying a quiet place where you have uninterrupted privacy for your telehealth session. Maybe kind of like test out your computer, your audio, really kind of like sit and get ready for the session. If you plan to arrive 15 minutes prior to your session, if you're doing in-person sessions. So give your time kind of like, we're going to work. We got to get to work a little bit earlier so we can settle in, check out the surroundings, find parking, whatever it is you need to do, right? Make sure you give yourself enough time to kind of like get there, find the place, park if you're parking, or, handle paperwork, whatever you're doing before that first in-person session. Next slide, please. So as I mentioned, maybe some questions that you can ask during your first session if you're not sure really like what to do or what to expect. You can ask questions kind of like, what prior experience do you have? Which topics or areas of expertise do you specialize in? What are your office protocols regarding booking, appointments, cancellation policies, payments for missed appointments, and emergency cancellations? I would say this one is super important because every therapist kind of have their own rules and policies regarding like cancellations, emergency cancellations, or kind of like how they book their appointments. So please, please, please always make sure that you're asking your therapy this. Also, what is the policy for contacting you in between sessions or emergencies? We're human, right? I know we might schedule weekly appointments or bi-weekly, but there are emergencies, right? There's some times where we experience things in our life that can be unsettling and we're like, oh, I really want to reach out to my therapist. So please, in that first session, ask your therapist, if an emergency occurs, how can I contact you? Is it okay to contact you, right? Also, how long will each session last? I would like to let you guys know that depending on your insurance sometimes, that can affect how long your session is. Sessions are usually between 45 minutes to 60 minutes, but always confirm with your therapist what's covered and how long that session is. Also, do you see this as a long-term or short-term experience? Next slide, please. So first session continued. Now, things to expect from your therapist. The first session for some therapists might be considered a consultation. And what a consultation is an abbreviated session for you and the therapist to determine if you're a good fit to work together. Some therapists offer consultations for free, right? But once again, that's something that your therapist will let you know. And a consultation isn't really a first session. It's kind of like a 15-minute meeting where they're getting to know you and they're asking you kind of like what made you reach out, what are you looking for, and talking about if they're the correct fit for you. Now, another first session is called an intake appointment. Be prepared to answer a lot of questions. The therapist will explore kind of like your issues. You'll need to talk a fair amount during the initial session. They might ask you things about like your education, relationships, family, your presenting problems. So it can get really, really in depth with that. So just prepare yourself to talk a lot during that first session. I would like you to know that mental health professionals are legally required to maintain your confidentiality. unless you're in danger to yourself or someone else. Also, be prepared to complete forms. This can include questionnaires about you, consent forms, is it okay to interact with you via text, send you emails? Also, those forms will include billing and insurance information. Next slide, please. Back to you, Anna.
So important considerations about psychotherapy. So psychotherapy may require exploring unpleasant aspects of your life and can at times lead to feelings of distress or temporary increase in symptoms, right? So it's important to think about psychotherapy is going to get harder than before. It gets easier, right? And it just makes sense, right? Lots of feelings can be buried, right? That you don't think about on a daily basis. And when those feelings and those emotions and those thoughts start to resurface, it can get hard, right? The working with your clinician can be of support, help you to work through those things in a way that you're able to manage your emotions and give you the tools to manage your emotions during those times. But I want you to encourage you to stick with it because as you know, research says about 75% of people who enter into psychotherapy show some benefit from it. So really stick with it. Those unpleasant aspects are temporary, and it's really important to discuss what's happening for you emotionally as well as physically with your clinician, with your therapist, so that they can help you to support you and give you the tools to help you be well. Okay. Slide. So after session game plan. And so when we say after session, it's usually after the intake, maybe the first or second session, right? So intake, as Arabia mentioned, is that first time. It's not really a therapy session. It's intake, getting to know you, answering all these types of questions that the clinician will have. And so the first session will probably be more of a conversation, getting to know you, and really kind of delving into your goals after the intake. And so after your first, second session, we would help you to encourage you to think about, like, did you feel comfortable with the provider? Did it seem like a good fit to you? Were they listening? Did they do the things or ask the questions that were helpful to you? And if you feel like, okay, well, this is a good fit, I'm going to try this out. I want to work with this person. Then I encourage you to schedule a few more appointments, right? But keep that line of communication open with you and the therapist and helping them to understand what your needs are and how they can be of service to you. It is definitely possible that not every provider is a good fit for everyone. And so if the provider wasn't a good fit for your needs, I say help the provider to understand what your goals are, what is not being met, how they can support you. If it isn't, in the end of the day, if it isn't a good fit, I encourage you to have that conversation with them. It might be difficult, and some providers may be open to hearing that you'd like a referral, some may not. And so, you'll have to judge yourself and what that environment is like for you. But then if you find as though you can't have that conversation with the provider, then I say go back to those consultation calls that you may have had with other providers that you were kind of on the fence, not too sure about, to engage with them. Or you can always go back to EAP and say to EAP, listen, that wasn't a good fit. I'd love to get another referral. I'm sure your primary care physician could also be a great resource here as well. And you can always go back to Psychology Today to go through the different filters that you had to see if there might be someone else that you can do a quick call to a consultation call to see if they have availability. I think the important thing is if you're finding that this person isn't the best fit for you, think about what was missing, right? And now you have had that experience, you have a little bit more information about what your needs are. And so going forward to find a new clinician, you have a little bit more information to say, okay, well, this is going to work for me. This is not going to work for me, right? And so really thinking about what is best for you moving forward when finding a new clinician is going to be really crucial. Next slide. Righty. So in summary, boy, we got through a lot of information today. And again, everyone will receive these slides. So in summary, psychotherapy is a type of treatment that can, next slide, please, that can help individuals experiencing a wide array of mental health conditions and emotional challenges. And the unpleasant moments that arise, like I said, in therapy are generally temporary and important to discuss when present, and usually subside once you are achieving your goals. Next slide.
So, something that we discussed is knowing the difference in providers. Psychiatrists are medical doctors and are able to prescribe medication. So there was a question in the chat when someone mentioned, like, how do you know who to choose in regards to providers? Think about these things, right? If you're someone who's looking for medication management, then you need to know, like, a psychiatrist is the way to go. But someone also mentioned in the chat that I found very interesting is that, yes, psychiatrists are limited in the amount of time that they are able to provide services. And it's really kind of like on a monthly basis. They won't offer services weekly. And it's not talk therapy, right? It's not counseling. It's more so to kind of like figure out what's going on with you and if you want medication and that process. So then if we're thinking about that, a psychiatrist might not be the correct fit for you. So really think about what your needs are when it comes to picking a provider. Do you want to see someone on a weekly basis? Are you looking for medication? Does this person take my insurance? As we talked about previously. Also, a psychologist holds a PhD and they're generally orientated to the ways that thoughts and feelings interact with social factors. LCSWs and LMHCs are mental health providers with master's degrees, and we're qualified to evaluate and treat problems by providing counseling or psychotherapy. Also, psychotherapy is usually 45 to 60 minutes. So that's another thing, right? I think someone in the chat mentioned that psychotherapy is 18 minutes. And I just want to let you know, like, that's not true. So it's 45 to 60 minutes, depending on your insurance provider. Next slide, please.
All righty, so what's your game plan? Ask for help when there's an issue that is interfering in your daily life, right? And that's the most important thing. If you are really struggling and talking to your friend, your family isn't really helpful to you, I say, engage in someone who can give you a space to be yourself, an objective person, and non-judgmental. Right. And so that's what therapy really is. It's a non-judgmental space for you to be able to just express your feelings, learn some tools, and reach the goals that you set out to achieve. And before searching for a therapist, decide what your needs are and how you plan to pay. Yeah. What are your needs? Do you need someone just to listen? Do you like homework? Do you want to build skills? Like, what is it that you want to get out of this opportunity? Because this opportunity is for you and your growth and your support. In the end of the day, being able to pay for these services are going to be important as well. And there's lots of providers that provide services where they accept our insurance. And consider if you prefer virtual to in-person sessions. There are benefits to both, absolutely. And think about what questions that you want to ask. In-person sessions are available as well, more so now than it has been during COVID, of course. But virtual sessions does make it very, very accessible for you to participate in services. Begin your search by speaking with your primary care physician. I think that's a really great place, especially if you have a long-term relationship with your physician. New York City EAP is really wonderful in that they also have a wide array of therapists. They have people of different ethnicities as well as genders that can make all employees feel very comfortable. And Psychology Today can be a very great resource for finding therapists as well. Next slide. So I think I'd love to be able in our last few minutes to answer some of these questions. In Arabia, you can jump in as well. So we do have, I see a question here. Going from the top down.
There have been a lot of questions in the chat, and as we've been doing the webinar, I have been answering a lot of questions. Let's see.
Okay.
There was a question in the chat that says, does our insurance cover this? I'm not sure if you're referring to EAP, but EAP is a free service offered by the city. So you don't need insurance coverage to get EAP services. But if you're looking for specific referrals to therapists or groups or some other things, then insurance coverage is an option. You do have the option to self-pay when it comes to a therapist. But for EAP, it's free.
Awesome. I see a question here about therapy for a child. Therapy for a child is the same kind of HIPAA rights for your doctor. A child who is a minor will be the same type of rights they would have with their medical doctor. I think that was important when a clinician's working with a child, that they do have some sort of agreement and understanding with the child of when they will report and what they will report to the parents in order to make the child feel safe, that they can speak freely. And I think that's definitely something that a parent should discuss in advance with the therapist of what they can expect.
There are also a few questions in the chat that I would like to answer. Someone asked, if I reached out to EAP before, am I always going to work with the same representative? So no, right? EAP counselors have different schedules, and just because you've reached out before doesn't mean that you'll always get the same person. If you request that and the person's available, we possibly could accommodate that, but every time it's not always the same person. And so EAP does offer very short-term counseling, but that's also dependent upon your needs, and we would have to do an assessment to see if it's appropriate. So there is a limit to the amount of sessions, but once again, it's very person specific. So we would have to call, talk to you, kind of do an assessment and figure it out from there.
I see a question in the Q&A that says, does EAP compile an overall report about the issues facing staff? And no, they do not. And I'll say that because EAP is protected. Every person who attends a session is protected under the same HIPAA guidelines that you are protected under with your physician. And so all information shared with an EAP counselor is confidential.
There was also a great question in the Q&A that says, what are your thoughts on seeking a therapist who has cultural competency? And my thoughts are, it's very important. Our culture is a big part of our identity. So if this is something that's very important to you and you would like a provider that has some sort of cultural competency regarding your culture or your religion, I would say ask that provider. Also, please understand, right? You are the person that knows you the best. The therapist is just getting to know you, right? So you have to bring these things into the room because not all therapists are aware of, what's important to you. So please always let us know what is important. It's an important part of your identity.
Yeah, I want to just hone in on that, Arabia, because this opportunity for you to work with a therapist is really based on your needs, not where they want the conversation to go. And so I want to empower everyone to understand that that time is their time, and they should definitely respect the therapist for their knowledge and what they bring to the table, but also help them to understand how best to help you. There's lots of questions in the Q&A, and
Mhm.
so we'll probably have to follow up with a FAQ or document to go along with with the follow-up email that you'll all receive with these slides, as well as the recording and the resources that we'll provide with you. So in the interest of time, I think we'll have to move on.
Okay.